Thank you, Rodney. I have the challenge of following a Baptist minister who's a doctor, and a wonderful, beautiful doctor from San Francisco. Let's give my colleagues a great hand. As a minister, I'd like to ask if there are any pastors here, if you would stand so that you can be acknowledged. Any pastors? And I might add, too, that Healthy Oakland started in 2001 because of the violence and the crime in the city of Oakland. And it was the heartbeat of Bishop Reeves and Bishop Bob Jackson. So, Bishop Bob, again, we thank you, and Bishop Reeves, for giving us an opportunity to birth and bring the work of Healthy Oakland to the community. We want to certainly acknowledge, we couldn't have done this without our fine community partnerships of Supervisor Keith Carson. Let's give him a big hand. It's really important that if the faith community doesn't have the support of the policymakers and the decision makers, then we can't effectively do our job. We want to acknowledge and thank Sheriff Ahern and also Rodney Brooks for doing a really good job of making sure I got here. Give Rodney a big hand. Healthy Oakland, we have some wonderful partners. We started this years ago, Dr. Jeffrey Watson, Bishop Reeves, and I. We got a lot of support from Healthcare Services, Dave Kears, Alex Briscoe, also from Dr. Tony Iton, Arnold Perkins, and Michael Shaw, also from Alameda County Social Services Agency, Chad Hewitt, Carol Collins, Yolanda Valdovinos. And the city of Oakland began to work with us in 2008, the mayor's office and the office of Department of Human Services, Sarah Bedford, and her staff. And because of the support, the technical assistance, and the financial investment that all of these agencies made in Healthy Oakland, we were able to establish the first African-American faith-based nonprofit to operate in the state of California, licensed community medical clinic in California's history in March of 2009. Later that year, we partnered with the James A. Watson Wellness Center and Lifelong Medical Center, and we were able to win an open access healthcare award to provide medical services to men and women coming out of prison, to homeless men and women, and to transitional youth out of foster care. And by June 30th of 2010, these three cohorts would have provided over 4,000 free patient visits to men and women who qualify for what's called indigent care services in Alameda County. We provide what's called integrated health services. In integrated health, we provide medical services, mental health services, dental screenings. We also provide wraparound services. And wraparound services, people can come in and they can access what's called CMSP services, Medi-Cal services. They also can access general assistance, food stamps, and about 15 other public benefit services. We also provide free financial literacy. We also provide free tax preparation for the men and women who access these services. We are able to do this great work because we also hire, of our 50 staff, 25 are formerly incarcerated. There's a combination of programs, our Measure White Street Outreach Program, also our Community Health Ambassadors Program, and our General Outreach Services Program. These men and these women do outreach on a daily basis, on a nightly basis, reaching out to men and women in our community where it's very difficult and challenging to access men and women and provide the services to our community. We're also able to do this work because of the unique partnership and relationships that we have with groups such as America Works, Volunteers of America, and Oakland Private Industry Council. So what we have is a one-stop center where one can come in, and through this one-stop center, they're able to, number one, have a healthy handoff or a soft handoff from a doctor to a medical provider to a case manager. And there's someone who works with that agency who's formerly incarcerated, who understands their background, who knows their pains, who knows their challenges, but who also has become successful. The majority of our staff are now off probation, they're off parole, they're paying taxes, they have reconnected with their family, they're active in their local churches, and they're citizens that have given a positive contribution to our society. We were also able, in this year, after we became a state licensed clinic on last year, in order to sustain our work, we have been approved by Medicare, we have been approved by Medi-Cal, we have been approved by Blue Shield, by Family Pack, and we're also in the process of becoming approved by Alameda Alliance for Health. This will enable us to sustain our operation and not rely solely upon county support, but also the support of other funding streams that are out there. Another wonderful program we have is our Faith Initiative, where we partner with the faith community. And partnering and working with the faith community, we are able to provide technical assistance to other faith-based groups in the city of Oakland and Alameda County, so that these type of services can be duplicated in the city of Oakland or the county of Alameda. Thank you very much.